Business Week magazine did a report on a study by Dr. David Eddy, who looked at every protocol, every conventional medical protocol for drugs and surgery and all the rest of it. He could only find science to support about 20 to 25%. And other than that, 75 to 80% of the conventional medicine had no science that really supported it. So if you look at, say, angina or bypass surgery or cancer treatments, there's no studies. There's no studies that indicate any of that does any good. And we now know from studies on Alzheimer's that 99.6% of all the studies ever done failed. This is from the Cleveland Clinic. And it's because they were using the wrong approach. They were using one drug for one disease. Can you imagine in your wildest dreams that that's how the body works? There's one or two drugs that I know of that work that way, and the rest of them really don't work that way. And that's what Dale Bredesen found out. He found out that for Alzheimer's, you needed to address 36 different things because there were like 36 holes in the roof. And if you didn't fill them all, then you wouldn't have a chance in hell of getting anybody to have any chance of preventing or reversing Alzheimer's. Well, he took 10 patients, filled all 36 holes, and 9 out of 10 reversed their symptoms and went back to work and are doing fine after 3 years. It's a miracle. But he used one theory. He said monotherapy isn't going to get it done. We have to do multiple. We've done multiple for diabetes. We've done multiple for every other chronic disease. Why not Alzheimer's? So 2 days from now, or I guess on Thursday, we're going to actually have a class. We're going to have a workshop on Alzheimer's, a new program that I developed that we're going to market in 137 countries using not just the Bredesen protocol, but the protocol of about 20 doctors that have been working on this for 70 years to find out what the 36 things were. So I thought that was pretty cool to be able to say that. The Journal of Clinical Evidence reported that only 11% of current conventional medical treatments are beneficial. It's even worse than the 20 or 25%. Conventional medicine is now the #1 cause of death in the United States, accounting for over 900,000 deaths each year, more than cancer and heart disease combined. I don't know. These are headlines, and I don't get it, because I know a lot of people who think you can't say anything bad about your doctor because he might not want to see you anymore. And you might go, okay. The British journal Lancet published a large study that found that diet, plant-based, with yoga, here comes your yoga again, meditation, lifestyle changes can stop and reverse disease such as hypertension, obesity, diabetes, heart disease, and prostate cancer. Institute of Medicine reported in a Wall Street journal that a holistic approach to healthcare has been proven both scientifically and from a cost-effective point of view of treating most diseases. It's interesting, I'm working with a guy named Joseph Pizzorno. Joseph Pizzorno started Bastyr University, the largest naturopathic college in the world. Gets more NIH grants than any other university in the country. And he's an integrated naturopathic doctor. And he started this Bastyr University back in the 70s. He now has an artificial intelligence program that I'm now licensed to sell to employers. For 5 years, he treated 20,000, he had 20,000 employees use this in 10 different companies. The average cost reduction was 15% for every employer for 5 years.
What do you mean artificial intelligence?
All this complicated stuff, these scientific studies, are all put into one little program so that every time you put any information in, whether it's your health risk assessment or your blood test or whatever, it tells you immediately from all these studies, 100,000, whether you're going to have a problem or not and what to do about it. That's the Watson.
Like a meta, like all the...
Yes, every meta-analysis that you can imagine. This is like, the equivalent in conventional medicine would be Watson, IBM. The problem is they're working with protocols that only have science to support 20 to 25% of what they're doing, and they're treating the symptoms. They're not treating the causes. The whole protocol that Dr. Pizzorno has come up with is about functional medicine. It's about treating the causes of the disease instead of the symptoms. And that's why they're able to get these amazing results. And that's why, as someone who, and my whole business is workplace wellness, I thought, gee, this sounds like a pretty good idea. I think I'll get into this. And so we've been working together for the last 6 months, putting our agreement together. A book entitled The Natural Pharmacy has 15,000 scientific references. And this is interesting because what you hear a lot of time from conventional medicine is there's no science behind this holistic stuff, this alternative stuff. There's 400% more science behind natural functional medicine than there is behind conventional medicine. This is one of the biggest myths that's ever been perpetrated on the public. There's 400% more science behind what we do than what they do. The Cleveland Clinic became the first major healthcare provider to embrace holistic functional medicine. This happened in an airplane trip. They sat the CEO sat with Mark Hyman on a 7-hour flight across the Atlantic. And Mark Hyman was the president of the Functional Medicine Institute. And by the time he got done, Ellis Cosgrove said, we've been doing all the wrong things. We've got to stop. And Mark Hyman said, well, that's not going to happen because your doctors won't go for this, your patients won't go for this, your board won't go for this, nobody's going to go for this. For 2 years, they argued back and forth until finally Cosgrove convinced him, you have to come and do this for us. Because we've done more science since we first met, and everything you said is proving out to be true. We're doing the wrong things. And he said, before I leave the Cleveland Clinic, I want to make sure that I leave a legacy of having done the right thing, at least at the end. And so that was really interesting, that the Cleveland Clinic is a $6 billion provider, and they just decided to flip things. Now, does it happen overnight? No. You don't change an establishment system like that, but gradually they're doing every protocol that they get that works, they're switching it over to the holistic side.